doing the Ulnar Gutter back slab. So again, we're going to try and get our positioning first, and normally you need a little bit of pressure to get the fingers to the right angle. So when you're setting it up, don't be too concerned about the finished position, but just a general kind of idea for yourself of what you want. So you're going to have a little bit of deviation there again at the wrist. It depends on what the patient can tolerate really, but you're going for the extension, and then your fingers will be coming down anything between 70 and 90 degrees. But that will be dictated really on what the patient can tolerate. Some are really bad and swollen, others can manage it a little bit better. So to start with, we have a little bit of gauze that we're going to put between the two fingers, so that we don't have any problems with pressure sores. So that goes in here. 2 pieces of tape, just above the IP joint and below. And then we are going for our 2-inch stockinette for the fingers and 3-inch stockinette for the forearm. Someone's in trouble. Okay. So I'm just cutting that along the edge there, just to get a good fitting around the fingers. That's the 2 fingers covered. And then the one for the forearm. Again, it's like the scaphoid and the collies, this one, just cut out space for the thumb. And there's your stockinette. Tear off a piece of wool again for around the fingers. I find it a little bit easier rather than trying to wrap from the roll. And then with your roll, you're starting again from inside out. 50-50 again down the forearm. Just a little tear at the thumb. And just finish it off there. You find if you tear the wool like that at the start, even it gives you a better, smoother finish inside. Again, we're using 15cm slab. What we do is we're measuring from the tip of the fingers up to the top of the forearm where you want to finish. So you've got that full length of slab there, 8 to 10 layers again. I'm not going to do 8 to 10 layers now just for the purpose of the video, but 8 to 10 layers of the slab. And then what we use for the slab is what we call the wine bottle shape. So basically you're cutting 2 pieces down here and you're coming out to the edge, and that gives you your plaster around the 2 fingers. So that's the shape you're aiming for, okay, like a bottle. So again, into your water. Make sure it's nice and smooth again on the side that's in contact with the skin. Now you're ready to apply it to the forearm. So start with the fingers again, just at the edge there, and smooth the slab into the wool. Gives you a chance to get the bandage on after without falling off. So press it into the hand. You have a nice mould there. You become more able to position after you get the conforming bandage on. So the conforming bandage again. Quick dip. Nice snug fit. So just wrap it, finish out the roll. You can tuck it in there when you want to stop. If you need to get that position right. So again, we're going for a little extension here, to show it this way. And you're coming down 70 to 90 with the fingers. So you might need to ease it down. Patients will find a lot of pain when you move it first, but as a few seconds pass by, it's easier tolerated. So you might start up here, but just give it a little nudge, push it down. You're going 70 to 90. And the important thing about the ulnar gutter is you need to hold this until it's almost set. You need to hold it longer than the other casts because the fingers will come back up. If you leave it go too soon, the fingers will come back up and you'll find your cast straight again, which is no good. You need to keep that pressure on until the cast is dry. Well, not fully dry, but almost. So that might take 4 or 5 minutes. Just make sure you're happy with your position. You should be able to see the top of the fingers there, just for circulation purposes. And again, once it's set, you tidy it up with another conforming bandage and you put the patient's hand up in the sling. And that's the ulnar gutter.